الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Healthcare Evaluation Professor Mahmoud Hani Sulaiman. Evaluation is general term given to assessment of whether something achieved its intended goals or outcomes. Assessment of whether something achieved its intended goals or outcomes. More fully, it is systematic, rigorous, and careful application of scientific methods to assess, design, implementation, or outcomes. Assess, design, implementation, or outcomes of a program, service, or other defined endeavor. Systematic, rigorous, careful application of scientific methods to assess, design, implementation, or outcomes of a program, service, or other defined issue. Organization providing health services or funders and service recipients all have interest in knowing whether services are safe, effective, and cost effective. Safe, effective, and cost effective. There are several main types of evaluation: outcome or effectiveness evaluation, process evaluation. Outcome or effectiveness evaluation aims to assess whether a program is effective. Economic evaluations consider whether a program is cost effective. Process evaluation assess whether components of a program function as expected and how they yield observed outcomes. Types of evaluation: outcome or effectiveness evaluation, process evaluation. Evaluation criteria: almost any activity, organization, or project. Any activity, organization, or project can be evaluated against a reasonable and measurable criteria. However, in healthcare, main criteria for evaluation are effectiveness, safety, efficiency, equity, access to care, quality of care, satisfaction, or acceptability. Again, evaluation criteria in healthcare mainly are effectiveness, safety, efficiency, equity, access to care, quality of care, satisfaction, or acceptability. Evaluation criteria continued. These defined more fully in coming figure. Some of these can be measured for individual patients or for whole service. For individual patients, as effectiveness of treatment or patient satisfaction with a service, while others as equity or efficiency can only be assessed by a whole service or community level. At level of health services, health systems, other criteria might also be important, as responsiveness or affordability. Main criteria used for evaluating health services or program: 4 in this slide and 3 in the coming slide. Here in this slide: effectiveness, safety, efficiency, and equity. Effectiveness, safety, efficiency, and equity. Effectiveness: whether and to what extent a treatment or health service achieves its intended goals. Effectiveness: whether and to what extent a treatment or health service achieves its intended goals. Safety: whether a treatment or health service causes adverse effect or harm. Safety: whether treatment or health service causes adverse effects or harms. Efficiency: Efficiency or cost effectiveness is the ratio of inputs to output. Efficiency is the ratio of inputs to outputs. Equity, whether a service or program is judged as fair. A service or program is judged as fair. Print this table and study it in details. Here, three criteria used for evaluating health services or programs: accessibility, quality, and satisfaction. Accessibility, quality, and satisfaction. Accessibility, whether people or those in need of health care can access the care or service they need. Whether people or those in need of health care can access the care or services they need. Quality, whether or not a service or care package achieves intended effectiveness, acceptable safety, and establishes adequate processes of care. Quality, whether or not a service or care package achieves intended effectiveness, acceptable safety, and establishes adequate process of care. Satisfaction, the patient or service user's overall judgment and specific views on a service or a specific episode of care. So these three criteria are accessibility, quality, and satisfaction. Print this table and study it in details. Levels of evaluation: structure, process, and outcome. Levels of evaluation: evaluation of structure, evaluation of process, and evaluation of outcome. In healthcare, three levels of evaluation are often specified: structure, process, and outcome. They will be discussed in the coming figure. This frame developed by Avedis Donabedian for understanding quality of medical care. These three levels to understand quality of medical care. Evaluating structure examines provision of resources, facilities, equipment, and staff to achieve particular goals. Evaluation of process involves assessing how much human and physical resources combined and used for those goals. Evaluation of outcomes involves measuring attainment of ultimate goals of project or program. Level of evaluation continued. Process of evaluation often involves qualitative research methods, as interviewing clinicians or patients or observing how care is provided in particular service. Qualitative research methods, as interviews or focus group discussions, are especially important for documented and explaining how patients experience care or how doctors and patients interact and make choices during clinical encounters. Donabedian framework for evaluating healthcare. The structure, or what structure, relatively stable, features such as the combination and location of buildings and major equipments, staff, grades, and mix it and communications infrastructure. Process, how the way components of the service interact. Typical patient pathways and care protocols might describe much of the process, may include service use and other intermediate outcomes. Outcome, effectiveness, safety, cost effectiveness, equity, accessibility, quality, patient satisfaction, etc. Patient-reported health outcomes, mortality, and clinical outcomes often seen as most important. Audit versus research. In healthcare, a key distinction between audit and research is recognized. mainly because research is believed to raise greater potential ethical concerns. In many countries, primary research involving data collection from about human subjects has to go through process of research ethics approval. In contrast, audit, the collection of data in order to assess whether an organization performance standards are being met, does not require research ethical approval. It also typically uses data that is already being routinely collected to compare performance against standards or targets which have been set extremely. Clinical, clinical, clinical audit is defined as quality improvement process that seeks to improve patient care and outcomes through systematic review of care against explicit criteria and the implementation of change. Patient and public involvement in healthcare evaluation. Health services evaluation traditionally conducted by clinicians, public health specialists, or health service managers, according to their service priorities and research interests. Today, however, patient and public perspective are seen as paramount. In the 1990s, much greater emphasis was placed upon using patient-reported outcomes as health-related quality of life. More recently, there are also greater expectations of patient and public involvement in all stages of research and evaluation, from survey design all the way through to interpretation and dissemination of findings. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.